Assalamualaikum and a very good afternoon, and thank you for tuning in. In this unprecedented time, we have to adopt and adapt to new ways of doing things, new ways of living, new ways of doing our work, going about our life, new ways of interacting with people. So today, I will share a new way in doing stroke rehabilitation, what we say a stroke rehabilitation in the new normal. So I've divided today's discussion into four areas. We will briefly give a bit of introduction on the pandemic and the new normal. And then we will discuss the issue of COVID-19 and stroke. I will walk us through the guidelines on the new normal for stroke rehabilitation and share with you how we do it in Rehab Hospital. And last but not least, we will share a journey of a stroke patient who had suffered a stroke during the pandemic. Okay. So COVID-19 is a very, very small virus and it has caused global pandemic. And most countries went through global lockdowns with borders closed. And this has a significant impact on the health system, the economy, and the social circumstances of the country. So it brings on new challenges, new ways of doing things, what we term as new normal. So Italy is one of the country that was quite severely hit with COVID-19. They had thousands and thousands of casualties and morbidity, and this has exhausted their healthcare system. And closer to home, Singapore also reported a slight strain in healthcare system. So strain in the healthcare system is what we feared most, as if that happened, hence we're not able to take care of all the sick patients in our country. So Malaysia, for us, we had come out strong during the peak. We wanted to flatten the curve. We went on a lockdown. We had undergo movement control orders, enhanced movement control orders, and now we are in recovery movement control orders. We still need to continue to stay strong so that we can break the chain. So these are some of the familiar scenes that we see. The frontliners, the barbed wires, Datuk Nur Hisham, the DG, who has held the team in battling COVID-19 very strong, right? And as of yesterday, we reported only 10 new cases. So hopefully we can see a single digit soon, okay? And Malaysia's effort is recognized globally because we are among the top 5 to have successfully contained COVID-19, which is very, very good. Coming back to COVID-19, COVID-19 is actually an infectious disease caused by severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2. It is spread between human during close contact, such as coughing, sneezing, and talking through respiratory droplet. The incubation period of this illness is 2 to 14 days, and lung is most affected, but the virus can also attack multi-organ in severe cases. So coming to COVID-19 and stroke, yeah, what is the association between these two conditions? Can COVID-19 actually cause a stroke? And can stroke patient get COVID-19? So if we look at the neuro manifestation of COVID-19, we can see that the virus can have direct invasion into the brain, right? It can create disruption into the blood vessel, whereby it creates a hypercoagulable state. It can cause damage into the blood vessels, and it can also cause increased inflammation. And this gives rise to brain tissue abnormality, what we call encephalopathy, viral encephalitis, And in severe cases, because of the thrombosis, it can also lead to a stroke. So this has been observed in many countries worldwide, and there are some reports that suggest COVID-19 caused sudden stroke in young adults especially. And this is also reported in one of the main journal, New England Journal of Medicine, that says large vessel stroke presenting as a feature of COVID-19 in young patients. However, knowing that, the good thing is that the stroke cases among COVID-19 are very low. However, if it occurs, the cases are more severe. All right. Okay, so coming back to stroke. Stroke is actually an acute onset of disruption into the blood vessel, and there's two types of stroke. One is caused by an infarct or a block, which is one of the pathology of COVID-19, and a bleed, right, which is bleeding in the brain. And just a quick reminder of the sign of stroke. So people who suffer a stroke, they will present acutely with sudden onset of face dropping, arm weakness, speech becomes slurred or jumble, and this is a time where you need to bring the patient soonest to the hospital. So the acronym for this sign of stroke is FAST, F-A-S-T. Okay. Just a quick reminder also on the risk factors for stroke. So we know that hypertension is one of the lead risk factors for stroke, followed by diabetes mellitus, increased cholesterol or dyslipidemia, atrial fibrillation, abnormal heart rhythm, aging itself put a person at risk of getting a stroke. Any patient with a family history of stroke has higher risk to get a stroke themselves, sedentary lifestyle, stressful lifestyle, or if anyone with any smoking history. Okay, hence, usually stroke patient, they will have multiple illness, they are much older, hence they are more vulnerable, and they do have higher risk to get COVID-19 infection. Okay. So if you look at the guidelines in managing acute stroke, what is emphasized is that as the treatment is given, the aim is to ensure the avoid rapid spread of COVID-19. Okay, so Malaysia has also developed our own guidelines whereby it is stated that all activities towards stroke awareness needs to continue and be maintained. Patients still need to seek acute treatment within 4 hours of onset. Acute care would still be based on evidence-based guideline and should continue to be followed. Hence, the inclusion of protected stroke code. This is to observe the manage the spread of COVID-19. And at some point in time, this can also cause delay in the treatment due to the new normal. Okay. So why is it important to get treatment as soon as possible? Because we look at the brain. If the patient comes in less than 3 hours, you can still see the green color pattern, which means that the tissue is still viable. But if the patient comes after 4 hours, then the tissue is no longer viable, the tissue is dead, and this will cause a more significant or severe disability for the stroke. So what about medical rehabilitation during this pandemic? What are the rehabilitation considerations? So we know that medical rehabilitation, just like acute treatment, still need to continue. We still need to provide rehabilitation, especially for severely affected neurological patients such as stroke. And we know that the principle of care for stroke patient is a combination of acute care and rehabilitation, because if the patient do not get rehabilitation, hence the treatment is not complete. So for us, we need to always check guidelines that is given by the international bodies, yeah, and try to modify it to suit at the national level. So this is the guideline that is given by the WHO in terms of rehabilitation consideration during COVID-19 outbreak, right? So it states that rehabilitation needs must not stop, right? Because lack of access to rehabilitation can compromise on health outcome. It extends inpatient stay, and it can also result in a lot of a preventable hospital admission. All right, but the key message that we need to know is that whilst you are giving rehabilitation, infection prevention and control measures, that means access to protective equipment, is essential in continuation of rehabilitation services. Okay, the priority patient includes patient who had suffered stroke, patient who had suffered heart attack. So these are the group of patients where you still need to continue a rehabilitation because otherwise they are at risk of suboptimal recovery. Okay. So the service options still remain the same. They're discharged from rehabilitation with comprehensive home program, or you can continue giving rehabilitation through inpatient, outpatient, even tele-rehabilitation, or in some cases, if it's cost necessary, there may also be a temporary cessation of program for the patient. So just to recap again, the broad recommendation is to ensure that the current standard of treating acute patient during this COVID-19 pandemic must be served, but they must ensure that safety is observed at all time. Okay, so the shift to the new normal, what is important? It needs to be done safely without risk of spreading the virus in rehabilitation environment, and safety is actually paramount. So safety includes doing screening for all patients coming in and out of the hospital. We need to do COVID testing and testing if it's permissible. We need to observe social distancing. Healthcare professional, public at large, patient needs to don on mask. So it's mask, 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 and mask. And the most important thing is hand washing, sanitizing, hand washing, and sanitizing. So these are the 5 cardinal things that is drummed into our head, and we need to ensure that this is followed at all time during this pandemic outbreak. So stroke rehabilitation in new normal still needs to continue. I need to emphasize that is a very important component of care, and it needs to follow existing guideline as much as possible. Okay, I cannot get it done. Okay, stroke rehabilitation is very important because it prevents complication, it promotes faster recovery, and it helps to improve patients' function much faster. And there are many components of stroke rehabilitation. There's the medical component, the physical component, the functional component, and psychological component. So this needs to be done and while adhering to all the safety precautions. So just a little bit about stroke rehabilitation. It involves very close contact with patient. It is always a one-to-one approach. When you do a full medical examination, physical therapy, functional retraining, speech and swallowing, where you actually have direct access to the oral cavity. So hence, stroke rehabilitation in the new normal is what we practice in regenrehab. We always maintain highest hygiene standard at all time. All our clinical staff and our non-clinical staff needs to don masks during at any clinical areas. All unwell patients will also need to use masks when in contact. There is a need for modification of therapy and nursing to try to reduce personal one-to-one contact, whereby we try to take a break every 10 minutes to give patient as well as staff a lack of exposure. We emphasize on hand-off remote coaching approaches whenever possible, instead of a lot of hands-on, because rehab has got a lot of hands-on approaches. We try to keep the distance at least 1.5 meters between all staff and patient whenever it's possible. We try to reduce ratio of patient using the therapy area, and as per the guideline, tele-rehabilitation is offered whenever it is needed. So these are some of the modification that we have done in providing a stroke rehabilitation in regenrehab in the new normal. So this is just illustration of our clinical therapy area. You can see that we have distanced our treatment area. The couches are put at least 2 to 3 meters apart. Single one-to-one patient contact. We have to ensure whether if we can use hands off as much as possible, but it's almost impossible, I would like to tell you. And of course, our therapies get to do outdoor therapy as much as possible because we are at the Liberty where we have got a beautiful garden outside, and this allow much more ventilation for our patient, better ventilation for our patient. We always do family conference, and a family conference is something that we still continue in this new normal, but we still keep social distancing, and we do in a well-ventilated area because we believe in updating the families of the patient's progress is an important component. Okay. Okay, so now I would like to share with you a patient experience, a journey of a stroke patient who had suffered a stroke during this pandemic. Okay, so she is a 76 years old lady. She had a stroke during Hari Raya. She was discharged from acute hospital after a couple of days. So when she was discharged home, she was still unable to move. She's not able to talk. She had difficulty eating. So hence, she was just bedridden at home. And she already developed pressure sore. So the husband, who is the carer, do not know how to handle this patient. So he SOS. So this patient is actually a close relative of mine, my mom's cousin. So he remembered that I was actually in rehab, and so he was trying to find and look for me. So this is the condition of my auntie. She was just bedridden at home, and because she was not moving and she stayed in bed too long, hence she developed pressure ulcer just as soon as like 3 days without turning. So after discussion, because definitely she's at least a moderate stroke and not a mild stroke, we agreed to admit her for further evaluation and rehabilitation. So the first thing that we had to do was to test her for COVID-19, and she was negative. So hence we proceeded with our medical rehabilitation treatment. Okay. So the first we did was to establish again the stroke, looking at the severity, what type of lesion it is. We list all the impairment that she had. We look at all her risk factors. We look at her current medical condition to assess her suitability to participate in rehabilitation approaches. We set goals for her. We prescribe the rehabilitation management. We look at all her medications, what sort of intervention that is suitable, and what sort of functional training, and most importantly, carer education. Okay. So carer is taught how to handle patient. Simple things like bed mobility, turning, transfer, nursing care. We had to look at the wound to ensure that there's no progression of the wound. Look into the swallowing. The good thing is she was still able to do oral swallowing, and we start off restorative therapy to restore all the weak muscle. Okay. So this is our occupational therapy, teaching the carer how to teach her to sit up and also to perform a safe transfer into a commode chair. Oh, there's no voice. Let me just do that again.
Pegang satu tangan macam ni. Nanti tengok ah. So I shift sini, then tangan saya dekat sini. Then I kasih tu lah. Okay.
Kasih dia move sikit.
Move sikit baru boleh transfer. Then satu masih pegang tau, tak boleh lepas. Okay. Ni. Kena okay, never mind. Okay, so kena as near as possible. Lepas tu kita kena keluar lagi ke sini sikit lah, baru boleh transfer. Okay.
So we teach carer step by step. We guide them. We also introduce suitable equipments to assist them in handling the patient. So this is very, very important step in.
Breathe in, breathe.
After a couple of days, she made good gains in rehabilitation. She improved. She was able to sit up. She was able to eat independently. The carer is more competent in handling her, able to handle her bed mobility and transfer. She also regained some movement over her weak upper limb, and she also had improvement with the wound, which is good. So after doing rehabilitation with us and after achieving the goal that we have set for her, we feel that she can actually continue rehabilitation as outpatient. So this is a day of discharge where our team will guide the family member how to do the car transfer.
Sebab tu kalau you tak ada yang ini uncle, it's very difficult. One, two, kepala dia ya, kepala dia. Okay.
Okay. Right. And emphasizing to the family members still to observe all the 5 cardinal rules, reminding them about continuation of home rehabilitation, nursing care, assuring them to adopt all the techniques that has been taught to them during the inpatient stay. So after about a week, I got a message from my uncle. So this is what he sent to me.
Apa?
Jam berapa ya?
Sekarang jam 2. Cuba bicara.
Halo.
Bicara sama siapa?
Santai yuk.
Ha?
Oh, telepon tutup lah.
Ya mana?
Manado ke?
Manado. Manado dah putus. Sudah bicara dengan Merit tadi?
Oh ya.
Mau bicara?
So she has regained more spontaneous speech. She has improved further her arms and her leg movement, which is very good. So the take-home message here, stroke is a disabling condition. Rehabilitation needs to be done as early as possible because this will definitely prevent complication. You promote faster recovery and improve function. So you can imagine if my auntie were to be just left at home, bedridden, she's going to get worse. Her pressure ulcer is going to get worse and she's going to get a lot more complication than what she had. Okay. So we would like to continue providing rehabilitation for all our patients who is in need of rehabilitation. But again, in this new normal, we have certain precautions that we have to take. Okay, group activities has also been reduced tremendously because we do not want them to be close to one another. Okay, all right. So before I end, I would just like to share a checklist to all of you, important factors to consider in choosing a rehabilitation program. So some of the things that we need to look into is whether the patient is suitable with what type of program, whether is it inpatient program or outpatient program. And if you are choosing an outpatient program, is there someone who will help you at home or to transport you to the facilities? Does the program that you choose has got medical coverage on site, has got speech, physio and OT all under one roof? Are patients and relatives involved in rehabilitation decision, because it's very important to get them involved. What is the cost? Is the cost covered by any funding? Is the program suitable to match your abilities? Is it too easy, too demanding? And most important thing is that the program has to have a good reputation, okay? Because in this new normal, not only we need to give good rehabilitation program, but we also, the facilities need to be able to observe all the precaution, all the protective equipments in place. Okay. So with that, my conclusion is stroke rehabilitation, stroke care need to continue and follow all standard precaution for COVID as to prevent the spread of the infection. Stroke care to continue as per our Malaysian guideline, and stroke rehabilitation will continue to be provided with strict precaution. So with that, I would like to thank you again for your kind attention.